Welcome to the Growth Mode podcast, where real conversations fuel real business growth. Hosted by Nina Labbe, media strategist with Salem Surround. Get ready to listen, learn, and grow. This is Growth Mode.
Have you ever wondered if it's possible to feel younger or look younger? Well, today you are in for a real treat because we have an expert at just that. Welcome.
Well, thank you very much.
To the Growth Mode podcast, Dr. Williams. I'm so excited to have you.
So am I. I'm very excited to be here.
Thank you. Yes, so Dr. Williams is someone who is transforming the way we think about health, healing, and aging. Dr. Williams is the founder of the Wellness Aesthetics and Medical Center right here in San Antonio, and he's helping patients move beyond traditional medicine into something much more empowering. Wellness, regeneration, and longevity. And we'll be talking about the 3 phases of medicine, the latest advancements in aesthetic treatments, and his new book, Grow Younger Like Me, B29 Again and Again, How to Look, Feel, and Function Younger Without Stress. You've got to get this book. And if you ever wondered how to look and feel your best, not just now, but for years to come, this is an episode you don't want to miss. Let's get into it, Dr. Williams. And I always like to know what inspires people. What inspired you to build a practice that focuses not just on treating wellness, but on a full spectrum of total wellness and aesthetics?
Well, to understand that, you have to go back to the beginning. I was born in Trinidad and Tobago. And when I was 9 years old, I was cutting grass with my cousin. And he was using a sickle behind me, and he sliced my heel.
Ouch.
So I went to the doctor, and he sewed it up. But the smell of the ether in the room so excited me that I wanted to become a doctor. Well, when I was 11 years old, I moved to New York City. First, I lived in Harlem, then the South Bronx. And then after that, I went to Harvard University undergraduate, then Albert Einstein Medical School. And then I did general surgery in Pittsburgh, Pennsylvania.
Okay.
Now, while I was there, an Air Force recruiter came by and he says, "Why don't you become a flight surgeon, travel the world?" And I thought that sounded great. So I was stationed at Travis Air Force Base in California. And true to his words, once a month, I got to fly with the crew anywhere in the world I wanted to.
Oh, how exciting.
I was having so much fun that I started feeling guilty. Doctors are supposed to be very busy all the time.
Yes.
And I wasn't. I was having too much fun.
Yeah.
So I told the Air Force I wanted to get out. And they said, "Why don't you go to Wilford Hall and do radiology?"
Okay.
Sounded good. So that's how I ended up coming to San Antonio.
Okay.
Right? Then after that, I got out. But something happened along the way. I was doing a lot of emergency medicine. And so I was treating patients in the emergency room. You had a problem, I prescribed a pill for you. And then one day, I woke up and suddenly I started gaining weight. I used to be 5'10", weigh 160, 170 all my life. And suddenly, I had blown up to almost 300 pounds. And I didn't know why. So I went to see my doctor, and he diagnosed me with a pituitary prolactinoma. And that tumor was in my brain, and what it did was it increased my estrogen level. And estrogen is a hormone in women that makes your breast bigger, prepares you for breastfeeding, give you that mommy brain that you can sense things wrong with your baby, with your child. And so during that time frame, I was gaining a lot of weight because of this, and my sex drive was decreased because I had too much estrogen. So after about 10 years of traditional medicine, I was on a cruise, and I looked at myself. I said, "Vernon, what are you doing to yourself?" Here I was, I weighed over 300 pounds, I just knew I was going to get diabetes, I was going to get high blood pressure, I was going to get heart disease, and I was going to die.
Yeah.
That's when the light bulb went on. And I said, it can't be this way. And so I started trying to fix my problem. Now, typically in Texas, we need to have 12 hours of continuing medical education per year. I was doing 300 a year.
Wow.
I was traveling all over the country, going to seminars, learning, and I kept learning. The more I learned, the more I understood things. And that's how I ended up starting the Wellness Aesthetic Medical Center, because of that, trying to fix myself.
Wow. You know, it's like it has to come from a place of pain to like open your eyes and your brain to want to be inspired to start something new. I love that journey. So another thing that I did want to talk about is the 3 phases of medicine. And we'll start with traditional medicine, how you define it and what are its limitations when it comes to long-term health.
Well, you have to understand something. Sick people who have pain don't want sex. So when I started out with my medical practice here and at One Aesthetic Medical Center, we took care of sick patients first. But the funny thing is when we started getting rid of the pain, then people who don't have any pain, they won't have sex.
They started feeling like themselves again.
Yes. But you can't have sex unless you look good. So they needed to look good to have sex. So we started with initial traditional medicine. Then we moved to regenerative medicine for the aesthetics. And then we moved to continue that with for sexual health. And then we moved on to the 3rd phase, which is longevity medicine. So let's talk about the 3 of those things.
Yes. I do want to talk a little bit more about regenerative medicine and what does that look like in your practice and how is it, changing the way, we approach healing.
So first of all, traditional medicine is Band-Aid medicine. In other words, it's a pill medicine. So if you have high blood pressure or diabetes or heart disease, you are put on a pill. And that pill is going to be for the rest of your life. So 10 years down the road, your problem has actually gotten worse. So what have they done? They've increased the strength of your medications. You think you're okay, but you're actually getting worse.
Because you're only treating the symptom.
That's traditional medicine. Regenerative medicine are for people who have pain, they have high blood pressure, diabetes, and what we try to do is we try to dig underneath and find the reason why you have it and try to get the problem to be resolved. Maybe losing weight, maybe doing things like looking at your hormones, doing different things to get your body back to normal by getting rid of the problem. That's regenerative medicine.
Right. Okay.
And now, over the last 5 years or so, we have now gone into the realm of longevity medicine. These are young people who look at themselves and they say, I don't want to get old. These are the people who has a problem that they perceive as a problem that's not covered by insurance. These are people who say, I feel great at 40. I want to be 100 and I want to perform like I'm 40. And so they want to do things that will keep them getting healthier as they get older. And that's what longevity medicine is all about, finding ways to keep you looking better.
I'm curious, are there any regenerative treatments that patients are most excited about?
Well, there's lots of them. And my practice here is a lot different than the other longevity practices. Most longevity practices are geared towards your insides, making your heart function better, making your lungs, your kidneys, your organs function better, makes your muscles better. That's what most longevity clinics are. But they don't take into consideration the other aspects. You want to look good also as you age. And you want to be able to perform sexually better as you age. And my practice takes into all those considerations. Let me give you some examples. I went to a practice to visit a doctor in California in Napa Valley. Mm-hmm. Now, this doctor had done over 100,000 laser treatments. Mm-hmm. And I noticed that he had a lot of 20-year-olds that would come into his practice for laser treatments. Mm-hmm. And I asked him, why all these 20-year-olds come to get lasers?
Yeah.
They have great skin.
Yeah.
He said, well, what has happened is that they're looking at their moms, who are my patients, and they say to themselves, boy, when I grow old, I want to look like my mom. Mm-hmm. Typically, you say, I don't want to look like my mom. Mm-hmm. But because their mom's skin was looking so much better, these 20-year-olds wanted to look like their moms when they were in their 40s.
Yeah.
Their friends were saying, hey, your mom looks like your sister, and so they were inspired by that. And that's an example of longevity medicine, where you actually look better as you get older.
So smart. Mm-hmm. So smart. I love that. I love it. All right. Let's talk a little bit more about longevity. Mm-hmm. It's a word that we're hearing more and more. What does it truly mean, like from a medical and wellness perspective?
All right. Well, let's look at it this way. All right. Longevity is doing advanced testing to find out what makes you tick. What makes you tick better. Like, for instance, I did a genetic test on myself. And on the genetic test, it told me two things. I had a splinter gene, and I also had a bitter gene. Right? A bitter gene means that anything tastes bitter to me. And so that is what provokes me to put sugar in everything I eat and drink.
Wow.
That bitter gene explained why I had a sweet tooth.
Okay.
Now, I also had a splinter gene. A splinter gene is a gene that makes you, when you exercise, you need to do things that are quick movements. So things that are fast, like not long distance running, things that are aerobic type things, so like run the 100-yard dash. Those are the kinds of exercise that my body craves. Okay. So let's say I notice, or let's say I didn't notice, and I'm doing long distance running. Yeah. That is not the best thing for my body. My body wants quick movement types exercise, boxing, those kinds of things. And so knowing these things, it helps you. Let me give you another example. You do a genetic test and it looks at your skin. Well, it tells you what kind of products your skin wants. Yeah. Now, a woman, she's in her 30s and she's doing all kinds of lotions on her skin. Wouldn't it be nice to know that you're giving your skin the right lotion? Yeah. Here you are, you're spending thousands of dollars every year on your skin, and you find out 10, 15 years later that you're giving your skin the wrong medications because that's not the one that's for your skin. So these are things that all can help you. Longevity, so doing the advanced testing, genetic testing, doing testing that genomics, finding out what makes your body tick, what makes things better. If you injure your knee, find out what nutrients is best for your particular knee, not everyone else's. So knowing these things, weight loss, knowing what kinds of things that you can eat that agrees with your body, those things help you recover quicker and helps you grow faster.
Yeah, so much learning here. It's so fascinating. How do you help patients shift their mindset, like from sick care to life extension and vitality?
Well, people have to get off of this. I need to have insurance. Insurance is the crutch that's holding everyone down. Everyone wants something that's covered by the insurance. Well, insurance and the drug companies are in bed together. Insurance covers what the drug companies wants them to. So let me give you, let's say you have a thyroid problem. If you have a thyroid problem, they will put you on a thyroid medicine that's called T4. T4. Now, T4 is not active in your body. They give you the wrong thyroid medicine for your problem. Your body has to convert that wrong thyroid medicine into the one that works for the body. Now, if you aren't doing insurance, you can get the actual T3, which is the one that your body needs. Okay. So how do you know that your body doesn't even accept it? I mean, so they give you T4, that's thyroid of 4 iodines, and your body has to convert it into T3.
Yeah.
What if your body can't do it? They're giving you something that doesn't work for you. All right? So, and then they don't even test for T3. They test for T4. All right? And so it's very important that people get off the insurance mode and realize that you have to pay for your health care.
Yeah.
Just like you have to pay for your food. There's an old saying. There's an old saying that food, let food be your nutrition and nutrition be your food. So in other words, you want to get the food for your body that works for you.
Right.
All right?
The natural medicine. Okay. Let's shift gears a little bit to technology and aesthetic innovations. Your clinic offers some of the latest advancements in aesthetics. What are a few cutting-edge treatments or technologies you're most excited about right now?
Well, I'm proud of our practice in the sense that, I always look at things in my eyes. So when I have a patient, I always think to myself, if I was that patient, what would I want? And I do what I would want to do. I believe that combination treatments are better than mono treatments. In other words, in medicine, 1 + 1 is not 2. 1 + 1 is 6. So if you put two things together, i.e. put growth hormone and testosterone together, you don't get the benefit of just those two.
Yeah.
You get the benefits of everything else that goes with it. Right? So in our office, we probably have over 20 different machines. If you come to my office,
That's a lot of machines.
yes, and they're all cutting edge machines. I've paid millions of dollars for my machines. My problem is that every time I go to a conference, my staff says, please don't buy a new machine.
Oh.
Because I go to a conference and I see something. Yes, I have it in my office, but this one works better. It's less uncomfortable.
Yes.
It's faster. So I get it. And then now I have, so you come to my office and you have a problem. I have 4 machines that does the same thing.
Yeah.
Now I have to figure out which one I want to give you or what combination I want to use from it. So in other words, I'm going broke. Going broke saving money and helping my patients. So I have too many machines, but they all result in better care for my patients.
Right.
And
They all have a purpose.
Yes. And all the machines in my room I use.
Yes.
So I use them all myself. And, because I want to be the number one person growing younger.
Right.
So
and you look amazing.
Yes. So I've been trying. I've been working at it.
Yes.
And so I use the machines on myself. So there aren't any machines in my office that I haven't used on myself and Vanity, who is my office manager.
Yes.
We are guinea pigs. We try them all out. We know exactly how they feel. So you come in. We have done it.
Wow. Lucky staff.
My staff is very happy. They get to do a lot of stuff.
I love it. I love it. What types of results are patients seeing, and how do aesthetics tie into overall wellness and confidence?
Well, we have a machine. It takes a picture of your face, and it will tell you the size of your pores in your face. It will tell you what kind of sun damage you have. It will tell you all that stuff, and then it will rank you. So if you're 40 years old, it will tell you based on all the other 40-year-olds, you are in the 90th percentile, or you're in the 30th percentile. If you're in the 90th percentile, it means that you're better than 90% of the people of your age.
Okay.
If you're in the 10th percentile, it means that 90% of the people are better than you.
Okay.
And this machine, it has all our equipment in it, and it spits out what equipment is best for you based on the analysis.
Oh, wow.
Next, it will go back and show you how you looked 10 years ago, and will show you how you look 10 years into the future.
Oh, that's so impressive.
And so most women, when they see how they look 10 years from now,
Yeah.
they don't like that. They don't like that because no one likes the way they look in 10 years.
Right.
And so it tells you what you need to do so you don't look like that 10 years from now.
Wow.
And we have machines in our office. We have machines that build muscle. We have an M-Sculpt Neo. And, 4 treatments on your abdomen will increase your muscle mass by 25%. You'll lose 30% of the fat in your abdomen, and you'll lose 15% of your visceral fat just from that machine. It gives you 14,000 sit-ups in 30 minutes. 14,000. We have patients who come in. They're gym rats. They love to go to the gym. But once a month, they come to our office just to get 14,000 sit-ups.
Wow. And do they see the results like immediately?
Yes. You see the results. What you would is typically we like to recheck you 4 weeks after your last treatment.
Yeah.
And you'll see we have great before and after pictures on that. It works very, very well. I mean, so we have all of these things. We have a chair that's called an Emcella chair. That's for your foundation.
Okay.
That machine was initially developed for women who have incontinence.
Okay.
But it actually is a pelvic floor machine. You sit on it, it gives vibrations that goes into your pelvic floor. Now, it gives a woman 11,200 kegels in 28 minutes.
Wow.
You couldn't do 11,000 kegels in 5 years if you did it on your own.
Wow.
But it gives that. And it helps with lubrication. It helps with incontinence.
So it's like rejuvenating.
It's like, we use it for men also because it works on your foundation. The old saying is that if you water the roots, the tree will grow. Well, if you water the roots, the women's tree will also grow and it will be better. So these kegels tightens up the area. And so we could actually make it function better, make it lubricate better, make your orgasm better, and actually make it look better. So as you get older and start looking a little bit loosey, goosey, and sort of creepy looking, we can actually make it smoother and make it look young and healthy. So we can make that look young and healthy. Yeah. We can make this look young. We can make your muscle. We can do all that stuff.
Wow, that's so amazing. Can M-Sculpt, can it be used on the face? Like if you wanted to sculpt your face?
The company does have something now. It's called M-Face.
Oh.
And M-Face on your face, what it does, and we have the machine, of course. It improves your collagen in your face. It's like getting fillers without actually getting fillers, by actually pushing your body to make more collagen and make more connective tissue. So you get more body in your cheeks. It works on your neck, gets rid of this stuff that you have here, tightens this up here. And now there's a new one for the eyes that goes under the eyes and your forehead. It raises it so you don't need Botox with it and you don't need fillers. So it relaxes this, tightens this up, pulls this up. And so that's our M-Face, which is made by the same company, and we have those too.
Wow, this is so amazing. This is so amazing. I'm blown away by everything that you're telling me. I mean, this is great. I do want to talk more about your book.
Well, that's my first book. I do have another book coming out. It should be coming out in about a month. It's called Longevity Medicine: Secrets to Growing Younger. Ooh. And what I do is I go through the things you need to do to actually make your body younger and healthier. Not just your insides, but to get you more chiseled, to have fat in the right places and muscles in the right places, to regrow hair, to make your skin younger and healthier, to get rid of blemishes on your body that you don't like. If you have stretch marks, get rid of those. If you have cellulite, to get rid of that. It tells you how to do all of that stuff. It's in my book.
I'm going to be the first person to get that book. Say the name of the book again.
It's called Longevity Medicine: Secrets to Growing Younger.
And when will that book be?
Hopefully next month.
Next month.
I wrote the book almost a year ago. And it's been at a publisher. And it seems like every time I learned so much. I go to so many conferences. And every time I go to conference, I learn something else. And so every time I make a change, they take 3 to 4 weeks to add the change to it. And I feel like I need to stop because the book should have been out 6 months ago.
Right.
But I keep adding.
Yeah.
And it's just taking them too long to get it, because I feel like by the time the book comes out, it will be outdated because
Yeah.
I've learned so much more.
Right. Then you'll need to come out with another book.
Yes.
Well, this one is out now. Grow Younger Like Me, Feel 29 Again and Again, How to Look, Feel, and Function Younger Without Stress. I love the title of this book. Tell me what inspired you to write this book?
Well, I just wanted people to understand what I was learning. You know, I like to teach, and that book is helping people understand. It's written in a very easy to understand layman's term. So it's not written for the doctors. It's written for patients, so you can understand it. So it's very simple, and it also talks about myths in medicine, things that people tell you that is absolutely wrong, like cholesterol, the fact that cholesterol is actually good for you, and that you should not be taking cholesterol lowering drugs. It goes into all that aspects. It goes into growth hormone, the fact that they say that it enhances what you do. Hey, everything in life is about performance enhancement. You go on a date, guess what? You put on this stuff, guess what? You enhance your face. That's what growth hormone is supposed to do. And then they ban people from sports because they use growth hormone. Well, if you have pain, you take Tylenol for the pain, right?
Right.
Makes you perform better, right? Well, Tylenol would be enhance your performance, right? And so we talk about all that things in the book. So it's very simple written, but it's for everyone, and it's very easy to understand.
Anything else that you want the readers to take away from this book?
Well, I want people to understand there is a lot of longevity clinics coming up now, and they need to look at them and remember that in what I do is a different longevity, in the sense that it's not just looking at your inside. It's also looking at how you look, how you perform in the bedroom. It's looking at all those in addition. So I don't want you to be 100, feel great, but look 90. I want you to be 100, feel great, look 50, and perform like a 50-year-old.
Yeah.
That's longevity.
I love that. All right. So, for someone who is listening and wants to feel better, look better, live longer, where should they start, Dr. Williams?
Well, nutrition. Nutrition is the key. Nutrition and detox. Detox is critical. You know, when your car doesn't perform well, you take and get it tuned up, right?
Yeah.
Well, what do? They drain the fluid, the oil, put clean oil in it, and they fix things, now the car runs better. When you detox your body performs better. So when you shower, how do you feel? You just detox your skin. When you brush your teeth, how do you feel? You just detox your mouth. When you do number one, number two, how do you feel? You just detox your bladder and your colon. Anytime you detox your body performs better. So think of detox as tuning up your body.
Okay. All right. And where can listeners learn more about your services, your book, or even connect with you directly?
Well, they can call my office, which is 210-495-8558. That's 210-495-8558. Or they can get me on the website, which is www.feel29.com, because I'm Dr. 29, and so I want you to feel 29 like me, and that's my website, www.feel29.com.
Okay, that's easy to remember. Awesome. Dr. Williams, thank you so much for joining us on the Growth Mode podcast. You're amazing.
Well, thank you.
And thank you for sharing your insights on the future of medicine, longevity, and total wellness. It's been such a treat, from traditional care to regenerative treatments and advanced aesthetics technology. I mean, it's clear that you're helping people in all these areas. And if you'd like to learn more about Dr. Williams and his book, Grow Younger Like Me, Feel 29 Again and Again, or the services at the Wellness and Aesthetics Medical Center, you can also head over to twaamc.com. And we'll put all the links in the description. And if you enjoyed today's conversation, be sure to subscribe, leave a review, or share it with someone who you feel would benefit from this episode. Thank you again. Thank you again for listening. And until next time, keep growing.
Thanks for listening to the Growth Mode podcast with Nina Labbe. Stay connected, keep learning, and keep growing. Don't forget to like, subscribe, and share. And we'll see you next time on Growth Mode.
Want to grow your business online and on the air? Right now, when you sign up for a 6-month organic SEO campaign at $3,100 a month, we'll include a free radio schedule, 1 week per month for 6 months to help kickstart your visibility. That's a $5,000 value in radio advertising, designed to drive awareness and leads from day one. Don't miss it. Email Nina Labbe at growthmode@salemsurround.com or call 210-526-3626 to learn more.